Mitral regurgitation. Auscultation features and murmur sound description. Auscultation features. 1. Soft first heart sound due to partial closure of mitral valve. 2. Pansystolic murmur, mitral regurgitation throughout whole systole, high-pitched soft blowing murmur radiated to left axilla. 3. Mid-systolic click due to sudden prolapse of the valve. 4. Normal second heart sound, sometimes wide physiological splitting in severe mitral regurgitation. 5. Prominent third heart sound due to sudden rush of blood fill into the dilated left ventricle in early diastole. Remember, since a proportion of stroke volume is regurgitated, stroke volume increases to maintain the cardiac output. Therefore, left ventricle enlarges and apex laterally displaced in mitral regurgitation. Auscultation method. Best heard in apex with the diaphragm of stethoscope when patient is in the left lateral decubitus position and should check for radiation in left axilla.